The nursing interventions that will be conducted on John are vital signs that should be done every 4 to 6 hours. The rationale for this is that it monitors for deterioration and gives an indication of the hemodynamic status, which is a problem with Addison's disease. John will require this because it will detect and pick up minor changes early to prevent deterioration. The potential problems that the patient presents with are hypertension. Therefore, respiratory and heart rate will be risen to compensate for low blood pressure. Based on the first set of observations that have been done on John, this has already started to happen. John is fatigued and has muscle weakness, and he also has salt cravings, which is all indicative of low levels of sodium in the blood, which leads to mental confusion. The potential problems with this is that if the patient has anything less than 15 on the BCS, they're at risk of an altered state of conscious. The nursing interventions to treat this would to be conduct a Glasgow Coma Scale, and this would be done because having Addison's disease puts you at risk of an altered state of conscious. John has presented with abdominal pain for investigation and has a high temperature, which is a symptom of infection. The potential problems for this is that the patient could have glucose or infection in urine. A nursing intervention to treat this would be to complete a urinalysis on admission. This is done to give an indication of current renal function status, as excessive leukocytes in urine are an indication of infection. This will also involve a pathologist who would investigate abnormalities that present in the urine. John has presented with fatigue, muscle weakness and salt cravings, and the potential problems with this is that if the patient has electrolyte imbalance, he will become hypo or hyperkalemia, leading to heart arrhythmias. A nursing intervention that should be conducted is electrolyte imbalance, should be assessed every 30 minutes to 4 hours for the first 24 hours, depending on John's instability. This will be done through blood tests assessing urea and electrolytes. This is done so that the electrolyte imbalance is symptomatic of Addison's due to the lack of hormone secretion, and this will require a pathologist to read and interpret the blood tests taken. John is presenting with fatigue and is also pale. A potential problem with this is that he could develop an altered state of conscious and collapse. A nursing intervention to treat this would to complete a full blood examination with specific attention to his hemoglobin level, and this is done because fatigue is a clinical manifestation of low hemoglobin. Anemia is suspected and is confirmed by a blood examination. This will also involve a pathologist to read and interpret the blood tests taken.